Hello again. I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. I hope that you're having a great spring. What's new and exciting in the May 2016 issue of Mayo Clinic Proceedings? Well, let's talk about the Editor's Choice and Highlights articles that you can access for free on our website during the month of May. The Editor's Choice in the May 2016 issue of Mayo Clinic Proceedings is an original article on the relationship between exercise capacity and the risk of atrial fibrillation. Dr. Charles Versailles from the Veterans Affairs Medical Center in Washington, D.C., and colleagues from several national healthcare institutions report on almost 6,000 veterans who had a symptom-limited exercise tolerance test and no evidence of atrial fibrillation or ischemia at baseline. They found that increased fitness was inversely and independently associated with risk for developing atrial fibrillation. And that's interesting and very reassuring, of course, because prior data had suggested that even moderate increases in physical activity increased the risk of atrial fibrillation, yet the health benefits of exercise in other dimensions of cardiovascular disease are so well documented. This article is accompanied by an editorial by Dr. Samuel Esevatham from Mayo Clinic in Rochester. Sam's editorial takes us in detail through the shortcomings of the literature on the relationship between exercise and cardiovascular health, and he discusses what gaps in that literature are yet to be filled. The first highlight in this month's issue is another original article, this one on the effect that changing treatment guidelines have on stroke prevention in patients with atrial fibrillation. This article was written by Dr. Zefan Chow from the Taipei Veterans General Hospital in Taipei, Taiwan, and colleagues from a large number of Chinese healthcare institutions. In a cohort of over 350,000 patients with atrial fibrillation, they found that the newer, stricter guidelines for anticoagulation in atrial fibrillation from 2014 resulted in more atrial fibrillation patients receiving oral anticoagulants compared to the previous 2011 guidelines, and that this increased use was associated with better outcomes in terms of stroke prevention. The implication of this work is that stricter implementation of our clinical guidelines for the treatment of atrial fibrillation could result in improved outcomes for these patients. The second highlight in the May 2016 issue of Mayo Clinic Proceedings is an original article on the relationship between androgen therapy and rehospitalization in older men with testosterone deficiency. Dr. Jack Balarjian and colleagues from the University of Texas Medical Branch in Galveston, Texas, did a retrospective cohort study in a national sample of Medicare beneficiaries. In about 6,400 men over the age of 65 with a prior diagnosis of testosterone deficiency, receiving androgen therapy was associated with a reduced risk of 30-day rehospitalization. And these findings held up across a wide range of statistical analyses. If you consider the high rates of 30-day readmissions among elderly men, confirming this finding in future prospective studies could have broad clinical and public health implications. And of course, these are not the only free articles on our Mayo Clinic Proceedings website. Go to www.mayoclinicproceedings.org. There is something new almost every day. Please check it out. And while you're there, connect with us on Facebook, Twitter, and YouTube so that we can keep you up to date on what's being published online first in Mayo Clinic Proceedings between our monthly issues. And if you connect with us, we can also tell you about the latest news stories that came from material published in Mayo Clinic Proceedings. Now enjoy this beautiful spring. When I see you next to tell you about the Editor's Choice and Highlights articles in the June 2016 issue of Mayo Clinic Proceedings, it'll be high time already to get ready for summer. See you then. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.